Welcome to Language Access Academy. This recording is based on the National Standards of Practice for Interpreters in Healthcare, developed by the National Council on Interpreting in Healthcare. This audio clip has been crafted specifically for busy professionals and students, offering a convenient way to listen, learn, and enhance your skills. For efficiency, this recording only includes the Standards of Practice part. For other parts, please refer to the book. Let's get started. Accuracy. Objective: to enable other parties to know precisely what each speaker has said. Related ethical principle: interpreters strive to render the message accurately, conveying the content and spirit of the original message, taking into consideration the cultural context. Standard number 1. The interpreter renders all messages accurately and completely, without adding, omitting, or substituting. For example, an interpreter repeats all that is said, even if it seems redundant, irrelevant, or rude. Standard number 2. The interpreter replicates the register, style, and tone of the speaker. For example, unless there is no equivalent in the patient's language, an interpreter does not substitute simpler explanations for medical terms a provider uses, but may ask the speaker to re-express themselves in language more easily understood by the other party. Standard number 3. The interpreter advises parties that everything said will be interpreted. For example, an interpreter may explain the interpreting process to a provider by saying, "Everything you say will be repeated to the patient." Standard number 4. The interpreter manages the flow of communication. For example, an interpreter may ask a speaker to pause or slow down. Standard number 5. The interpreter corrects errors in interpretation. For example, an interpreter who has omitted an important word corrects the mistake as soon as possible. Standard number 6. The interpreter maintains transparency. For example, when asking for clarification, an interpreter says to all parties, "I, the interpreter, did not understand, so I am going to ask for an explanation." Confidentiality. Objective: to honor the private and personal nature of the healthcare interaction and maintain trust among all parties. Related ethical principle: interpreters treat as confidential, within the treating team, all information learned in the performance of their professional duties, while observing relevant requirements regarding disclosure. Standard number 7. The interpreter maintains confidentiality and does not disclose information outside the treating team, except with the patient's consent or if required by law. For example, an interpreter does not discuss a patient's case with family or community members without the patient's consent. Standard number 8. The interpreter protects written patient information in his or her possession. For example, an interpreter does not leave notes on an interpreting session in public view. Impartiality. Objective: to eliminate the effect of interpreter bias or preference. Related ethical principle: interpreters strive to maintain impartiality and refrain from counseling, advising, or projecting personal biases or beliefs. Standard number 9. The interpreter does not allow personal judgments or cultural values to influence objectivity. For example, an interpreter does not reveal personal feelings through words, tone of voice, or body language. Standard number 10. The interpreter discloses potential conflicts of interest, withdrawing from assignments if necessary. For example, an interpreter avoids interpreting for a family member or close friend. Respect. Objective: to acknowledge the inherent dignity of all parties in the interpreted encounter. Related ethical principle: interpreters treat all parties with respect. Standard number 11. The interpreter uses professional, culturally appropriate ways of showing respect. For example, in greetings, an interpreter uses appropriate titles for both patient and provider. Standard number 12. The interpreter promotes direct communication among all parties in the encounter. For example, An interpreter may tell the patient and provider to address each other rather than the interpreter. Standard number 13. The interpreter promotes patient autonomy. For example, an interpreter directs a patient who asks him or her for a ride home to appropriate resources within the institution. Cultural awareness. Objective: to facilitate communication across cultural differences. Related ethical principle. Interpreters strive to develop awareness of the cultures encountered in the performance of interpreting duties. Standard number 14. The interpreter strives to understand the cultures associated with the languages he or she interprets, including biomedical culture. For example, an interpreter learns about the traditional remedies some patients may use. Standard number 15. The interpreter alerts all parties to any significant cultural misunderstanding that arises. For example, if a provider asks a patient who is fasting for religious reasons to take an oral medication, an interpreter may call attention to the potential conflict. Role boundaries. Objective: to clarify the scope and limits of the interpreting role in order to avoid conflicts of interest. Related ethical principle. The interpreter maintains the boundaries of the professional role, refraining from personal involvement. Standard number 16. The interpreter limits personal involvement with all parties during the interpreting assignment. For example, an interpreter does not share or elicit overly personal information in conversations with a patient. Standard number 17. The interpreter limits his or her professional activity to interpreting within an encounter. For example, an interpreter never advises a patient on healthcare questions, but redirects the patient to ask the provider. Standard number 18. The interpreter with an additional role adheres to all interpreting standards of practice while interpreting. For example, an interpreter who is also a nurse does not confer with another provider in the patient's presence without reporting what is said. Professionalism. Objective: to uphold the public's trust in the interpreting profession. Related ethical principle. Interpreters at all times act in a professional and ethical manner. Standard number 19. The interpreter is honest and ethical in all business practices. For example, an interpreter accurately represents his or her credentials. Standard number 20. The interpreter is prepared for all assignments. For example, an interpreter asks about the nature of the assignment and reviews relevant terminology. Standard number 21. The interpreter discloses skill limitations with respect to particular assignments. For example, an interpreter who is unfamiliar with a highly technical medical term asks for an explanation before continuing to interpret. Standard number 22. The interpreter avoids sight translation, especially of complex or critical documents, if he or she lacks sight translation skills. For example, when asked to sight translate a surgery consent form, an interpreter instead asks the provider to explain its content and then interprets the explanation. Standard number 23. The interpreter is accountable for professional performance. For example, an interpreter does not blame others for his or her interpreting errors. Standard. Number 24. The interpreter advocates for working conditions that support quality interpreting. For example, an interpreter on a lengthy assignment indicates when fatigue might compromise interpreting accuracy. Standard number 25. The interpreter shows respect for professionals with whom he or she works. For example, an interpreter does not spread rumors that would discredit another interpreter. Standard number 26. The interpreter acts in a manner befitting the dignity of the profession and appropriate to the setting. For example, an interpreter dresses appropriately and arrives on time for appointments. Professional development. Objective: to attain the highest possible level of competence and service. Related ethical principle. Interpreters strive to further their knowledge and skills through independent study, continuing education, and actual interpreting practice. Standard number 27. The interpreter continues to develop language and cultural knowledge and interpreting skills. For example, An interpreter stays up to date on changes in medical terminology or regional slang. Standard number 28. The interpreter seeks feedback to improve his or her performance. For example, an interpreter consults with colleagues about a challenging assignment. Standard number 29. The interpreter supports the professional development of fellow interpreters. For example, an experienced interpreter mentors novice interpreters. Standard number 30. The interpreter participates in organizations and activities that contribute to the development of the profession. For example, an interpreter attends professional workshops and conferences. Advocacy. Objective: to prevent harm to parties that the interpreter serves. Related ethical principle: when the patient's health, well-being, or dignity is at risk, an interpreter may be justified in acting as an advocate. Standard number 31. The interpreter may speak out to protect an individual from serious harm. For example, an interpreter may intervene on behalf of a patient with a life-threatening allergy if the condition has been overlooked. Standard number 32. The interpreter may advocate on behalf of a party or group to correct mistreatment or abuse. For example, an interpreter may alert his or her supervisor to patterns of disrespect towards patients. Thank you for listening. Remember, repetition is key to mastery. Listen to this recording again and again to internalize all 32 standards. Doing so will not only help you pass the national certification exams, but also empower you to become an excellent interpreter, ensuring safety and quality care.